Hello, my friends. It is Dr. Darla from Cellmed Clinics, and today I want to talk about what you can expect from a PRP treatment. Now, I think it's really important to understand that everybody can experience this a little bit differently, and while we know some common patterns on how people heal and what we can expect, there's a lot of variability in the way that the body responds and the way that the body heals. So, what one person will experience may not be exactly the same as what the next person experienced. But I want to talk about in general what you can expect. So when we are injecting PRP, it is an injection with a needle, and depending on where we're going and what we're treating, we may be either going into a muscle, into a ligament or tendon insertion, or we could be going into a joint capsule. And each one of those areas feels a little bit different when the needle is going through the skin and into that area. There are certain areas of the body that are, the discomfort is more significant. Hands, fingers, feet, typically a fairly significant amount of discomfort can be experienced during injection. There are definitely some ways that we can help combat that. And the shoulder area tends to be a bit more painful in injection than, say, the knee. And the low back is oftentimes less painful than the neck. But it really just depends on a lot of different factors, including the patient's overall health, the area that we're treating, the type of injury we're treating, and also the length of injury. Things that we oftentimes don't think about that can impact how you experience this treatment is things like hormone status. So especially in males, if your testosterone levels are low, you may not heal as quickly from an injection therapy as you would if your hormone status was at a good optimal level. So that's important to consider as well. Age can be a factor, health status like diabetes or an autoimmune disease, so anything that would prevent the body from healing quickly, those can be factors in healing and what you experience out of your PRP treatment. And then if you are a smoker or a tobacco user, usually you will have a much more painful experience because of the level of oxidation that your body has overall from that particular habit. So if you're a smoker at all, or any tobacco user, or if you are a drinker and drink in excess, then you will oftentimes feel a significant amount more pain during the treatment than you would feel if you were not doing those things. So what can you expect after a PRP treatment? Generally speaking, within about 24 to 48 hours, most of the soreness should be gone. Now, you may feel more tight, tender, and less range of motion immediately following the injection, and that's because the injection technique and treatment is intended to increase inflammation. And it is that inflammation that begins and kicks off the healing process that the body will go through over the next several days to weeks. So it's important that we go through the uncomfortable part of healing in order to get to the part where the tissue begins to grow. And I talk a lot about the inflammatory pathway. It's actually a 3-phase pathway. The first phase being inflammation. That's where we feel pain. That's where we get stiffness. That's where we get some heat. Can also get some redness associated with that. And it is the acute part of an injury that lasts for around 48 to 72 hours, and somewhere between 48 and 72 hours, then we start moving into the second phase, which is what we call the proliferation phase. In proliferation, this is where we get new growth of tissue. So this is where the healing really begins to happen. And that phase can linger on for 21 to 28 days. So it's very common to feel a little bit worse and then start to get better. As far as healing patterns go, there's usually 3 distinct patterns that I see in the office, and that is that somebody will get their injections, get off the table, they immediately feel better, and they continue to feel better. I would say those are probably a lower percentage of people that experience that. Many people feel worse coming off the table and then start to get better. over the next 2 or 3 days, and then subsequently over the next 3 to 4 weeks. And then for some people, they feel better, then they feel worse, and then they feel better, and then they feel worse. And unfortunately, we don't have a linear path that our body follows whenever it's healing. So we may have a zigzag better, worse, better, worse, better, worse type of pattern. What we're really looking for over the long term, meaning 3 to 4 weeks, is that we want the severity of pain to be decreasing and the consistency of pain to be decreasing. So if you're feeling constant pain that's at a level 7 or an 8, we want to see that backing back down and maybe being pain that comes and goes, versus an all the time pain. So we can expect things like being able to sleep better range of motion, and less severe or less continuous pain. So those are the common things that we would expect to see over the healing cycle. And the healing cycle, like I said, is about 3 to 4 weeks. So expect to get a little bit worse, a little bit more sore, maybe some limited range of motion. Depending on the area, that can be more significant than other areas. The shoulder tends to be a little bit of a stubborn joint, tends to be a little more sore for a little longer than some of the areas of the body. But definitely that first 2-3 days can be unexpected if we don't tell you what you might experience. So it's all part of the normal healing process. It is expected for those of us who have been doing this treatment for very long. We kind of know what to expect. You should be getting that information from your doctor, and then we can, if that soreness and stiffness lingers on for more than 3 days, 4 days max, then you can always call the office and talk with the doctor and see, is there something else that can be done to kind of help alleviate that pain. So that's what you can kind of expect following a PRP treatment. Maybe get a little bit worse and then get better. Definitely sore for 2 to 3 days following the injections. And I would expect that there will be at least some level of discomfort during the injections, but everybody is able to tolerate it, and it's well worth the discomfort in the treatment to have long-lasting healing and be able to get back to the activities that you enjoy. And if you're having a severe case where you're not able to put your shirt on or comb your hair or reach up for something in a high cabinet, then definitely you can expect for those things to improve as well. So Dr. Darla, hope that was really helpful for you, and I will talk to you guys soon. Bye-bye. Have a great weekend.